if I can ask, what hurdles did you have that compelled you to seek out KLAS Solutions for our services?
So basically, starting out in dentistry as an associate and then moving on to owning a practice. I mean, obviously there's a big difference in between the two there. You kind of get into the swing of things, and once you own the practice, you start noticing how things are running. You have a lot of help kind of in the beginning. People are kind of, pushing you in one direction or another. The senior dentists there, your accountants, attorneys, different things like that kind of help you out. But then eventually you just end up, you're kind of on your own. And, sometimes you go through struggles and you end up having a situation where you don't really know which way to turn or what to do. In my particular case, that happened with me with my office staff. My first dental practice I purchased was in 2005, and I purchased one in 2013. I think it caused a little bit of jealousy throughout the staff and everything else, and I had some issues with people kind of turning against me. And me being a dentist, I was focused more on just the dentistry and the patients. I really wasn't focusing on my staff at the time. And I found out very quickly that that's not a good thing to do. You really have to focus on everything all the time. But we don't always have time in the day to do that. So for me, I needed some guidance and some education on how to be able to control that kind of a scenario within my practice to keep everything cohesive, to make sure that, not only were we taking care of the patients, but the office staff was happy, everybody was happy, and, the practice ran accordingly.
So then, of course, when you call us, one of the things that we always do is do a practice health assessment. And, you're familiar, you of course went through that process and so forth. And I guess basically, what was the, best outcome that you felt the practice health, our practice health assessment uncovered for you and your office? And was there anything that maybe surprised you?
I would say the biggest thing was looking at the hygiene program in my office. One of the things that I was kind of got to me was that we were just a prophy practice. We weren't really treating patients the way they needed to be necessarily treated, in the sense of, scaling and root planing as compared to prophy, as compared to a gingivitis patient, things like that. Looking at those situations, I kind of felt that we were doing kind of a disservice to those patients over that time frame, over the years. And it really kind of came about just, looking at that and being taught with the people that you have there at KLAS Solutions. We really got an idea of what we needed to do and how we needed to approach that on a level that would be feasible for everybody, patient and staff and everybody else. And I think that really kind of opened my eyes quite a bit on my end about dentistry, in the sense that, you just can't just treat a patient and, get them in and get them out the door. You really need to sit and assess the patient, assess their problems, and treat them accordingly. And to me, that really helped our team out, and it grew our team together because we all worked as a unit then. We were all kind of cohesive as a unit, being able to mold that in as one unit, and that really helped us out tremendously.
Awesome. So you've gone through our programs and systems. You went through our performance plan. What do you feel is the biggest change that KLAS has made for you and your team?
So I would say, number one, the unity of the team itself. That's a huge thing for me. There's absolutely no way anybody could argue with me that you walk into an office, if people aren't getting along, you can feel the tension in the air. That was one of the things that was happening in my office for, 16 months to, a couple years. You would walk in there and there was no communication. Nobody was talking with anybody. Everybody was just kind of doing their own thing. Patients could feel that. They knew what was going on. I mean, it was just, like I said, the tension. Now we're back to that one big happy family. Everybody's laughing, talking, joking, patient-wise, everything. I mean, it's just, it feels so good to have that back again. We lost that for so long. and it really affected the practice. And, you know, now that we have that back, I think that's the number one thing for me, is just that cohesion, that unity we have back. I mean, they are there for me just like I'm there for them, and they know that. And, you know, because of the teaching that we had from KLAS Solutions, I mean, that really brought us together as a group. I mean, and that was the best thing for me moving forward. I mean, it makes you want to go into work. You know, there were times when I just didn't want to go. You know, I didn't want to go to work because I knew that it was just going to be just a terrible place to be. It's, you know, and even though I was there for the patients and we did everything we could, just the tension that was there was just unbearable sometimes. And now, I mean, it's like walking on a cloud. I mean, it's just amazing.